Hey, this is Alex from Integration Nation Bodywork, and Jonathan and I would like to bring you a video today of self-care activities. This has been a long time in the making, or at least in the planning, but seeing as it's April 23rd right now, we're right in the middle of COVID quarantine. A lot of people are dealing without bodywork, including us, so self-care seems like a really good thing to start putting out there, so this is our contribution to that. So some of these are exercises, some of these are stretches, some of these are just movement re-education activities, but we've tried to organize them all via body region so that they're easier for you to find and work with. We've also placed links to all of the products we use that we demonstrate in there. Keep in mind, we're not paid endorsers of those products. We're not advertising them. We just really find them useful. Well, if you're a client or a student looking for a particular recommended exercise, check the description box below. We've itemized everything so that it's easy to find just say like 1 or 2 activities that you're looking to find. Keep in mind that this is not a specific prescribed exercise routine that we're recommending here. It's just simply a collection of our sort of most recommended, our favorite home care activities. As always, use caution with any new activity. Stop if anything causes pain. Remember that these should also not take the place of prescribed medical care when indicated. So, without further ado, on to the activities. Nice dissolve. Here we have 3 exercises that I call the back care triad. We begin with static back, we'll move on to the supine groin release, and then we'll finish with a wall sit. And I do recommend doing them in that order. They're no substitute for body work, but these 3 exercises have definitely gotten me through some rough times with my back. Here we have static back. Static back, the idea is we're just letting gravity realign the spine. So you don't necessarily have to use an ottoman like I have here. You can use a dining room chair or something like that. Just enough so that your hips and your knees are about 90 degrees. And the goal with this is just relaxation. Just let gravity pull your spine into a better alignment. Supine groin release. This is a great one for anybody who's got, like me, PSOAS related low back issues. Again, just like static back, it allows gravity to pull the psoas back, to relax it, to pull the femur and the hip back. So what we're doing here is we need one leg up, hip at 90 degrees, knee at 90 degrees. The active leg, the leg actually getting the release, is the straight one. In order so that it really best affects the muscles we're looking for, we should keep the foot pointed toward the ceiling, which is why I have a body wheel at my foot to keep my foot pointed straight at the ceiling. Patience is definitely a thing with this release. It will often take 10, 15, 20 minutes to fully let gravity ease your hip back out. And you'll want to do this with both legs, though usually one leg needs it more. You'll discover this with time and practice. Wall sit. These can be done at a variety of different levels, starting a little higher up. Basically, the higher you put your hip, the easier it's going to be. So if you're just new to this, try it like I'm doing it right here, a little bit higher up on the wall. As you get stronger, you can lower yourself down. Don't be concerned about being with your hips and your knees at a perfect 90-degree angle. The idea here is that we are re-engaging the quadriceps, and we're using that contraction to push the hips as evenly as possible against the wall. So we're essentially using our own muscular contraction in our legs to be able to relax and ease and even out the tone in the back and the hips. And it doesn't take long in wall sit to get the effect. You can actually feel this happening. So it doesn't have to be, one of these 8-minute endurance wall sits to be effective. We're not looking for a great deal of strengthening. What we're looking for is re-engagement and body positioning to allow the hips and the back to even out their tone. You can usually feel this happening as you press against the wall. And as soon as that starts to happen and you feel your back easing and shifting and releasing into the wall, that's how you know you're done. Oftentimes, it only takes 15, 20, maybe 30 seconds in a wall sit for this to happen. Clamshells are a standard exercise for engaging the lateral gluteals. That includes gluteus medius and minimus, all on the side of the hip. You simply put your feet together with knees bent about 90 degrees, and while keeping your feet together, lift your upper knee off the other one as far as you can comfortably and back down. You can do these as fast as I'm doing them, or you can slow them down a little bit. You'd be surprised at how few you can do before it really starts burning across that lateral hip. Straight leg raises are another way to engage the lateral gluteal fan. Because the leg is straight, we're using a little bit more effort and a little bit more force and engaging them more strongly. So we usually recommend starting with clamshells and then progressing to the straight leg raises. It's really easy to tip forward or backward when doing this, so be careful to keep your hips straight and even and perpendicular to the floor. Another thing to watch for in this move is to keep your leg straight and to also make sure it is in line with the rest of your body as you do this. You can see from the top view that this is happening. There's a tendency for people to want to bring the leg forward and engage the TFL, but we want to stay away from that. We also want to stay away from engaging the piriformis. When this happens, the leg will want to turn itself out. So make sure you keep your foot pointed straight forward and your legs straight and in line with your body as you do these. The adductor straight leg lifts are pretty straightforward. You want to get your upper leg out of the way. Again, keeping your hips straight and perpendicular to the floor. Using your bottom leg, keep it straight and just simply lift it as far as you can up off the floor. You don't have a lot of range of motion this way, so don't expect to lift your leg very far off the ground. Remember that at this level, we're not trying to really strengthen the adductors. This is not like a weight training exercise for them. We're simply trying to re-engage them. One way to engage the adductors is to bring them into an abdominal exercise. Here you can see a basic crunch like I was doing for the frog abs, but just put a ball and squeeze it between your legs and you'll get adductor engagement as well. Before you start, make sure you're engaging your transversus abdominis. It helps to keep the shoulders engaged as well as you lift, and then you only need to squeeze a little bit into the ball to engage the adductors through this exercise. If you don't have an exercise ball like I have here, you can also use a yoga block. I've even used a rolled up towel when I've been away from the house and needing to do this exercise. Hip thrusts or shoulder bridge is a really good way to re-engage the posterior gluteals. Again, these are often weakened muscles in a lot of postural dilemmas. Make sure you're firing the transverse abdominis to get started and then keep that engagement the entire time. And then more or less keep your back straight and push your hip up until it's in alignment with your back and your knees, and then back down. Frog ab crunchers are one of my favorite exercises. They reactivate the gluteals, the abdominals, and a lot of the shoulder stabilizing muscles like serratus anterior all at once. When doing this reactivation exercise, you want to contract the gluteals to hold your legs out to the side. As well, you want to pull your shoulder blades together and downward to help reactivate the shoulder stabilizing muscles. Then you just lift up into a slight crunch and back down. Again, there's not a lot of motion to this one because remember, we're trying to retrain the brain, not necessarily the muscles. Kneeling arm circles, so deceptively simple. So the kneeling arm circles can really burn through the shoulders, but the point of this exercise is actually not as much the strengthening re-engagement of the shoulders as it is retraining the transversus and the hip muscles to maintain coordinated posture and hold. So you want to make sure that your transversus is engaged, you want to make sure that your hip is level. Oftentimes this means contracting the glutes before you pull the shoulder blades together and down and then do the arm circles. Ideally, you want these arm circles centered at the level of the shoulder. Arm circles can be done forward and backward as you see here. The Chi machine is a great tool that I often recommend for clients that have a hard time relaxing, especially when moving legs or arms or the head around. You can see that as it jostles the legs back and forth, the hips, the spine, the head, they all have to move in concert with that. It has a variable speed motor so that you can change how fast it moves back and forth, so you can find your sort of sweet spot. Jostling tends to relax muscles and mobilize joints. And so that's the idea behind this machine. It's simply using jostling to make that happen. When foam rolling out the lateral gluteals, you really want to make sure that you stay away from the top of the iliac crest and the greater trochanter. The iliac crest is the top of the hip bone. While there's muscle attaching above and below the iliac crest, we don't want to be foam rolling right across the bone itself. The same thing goes for the greater trochanter. There's no muscle sitting at the top lateral end of the femur, and we definitely don't want to irritate the trochanteric bursa. So I suggest that you find a way to lean over the foam roller so that you can put some weight into the side and just let the weight of your body do the work. This can be pretty intense, and it should not be too intense. It certainly can be challenging. It's certainly not super comfortable to work on these muscles. These lateral muscles are definitely stability muscles, and they don't want to let go easy. So take your time, sink into it, find some spots that are really talking to you, push them just enough to challenge them, and then wait for that tissue to melt and release and let you know that it's time to move on. The side of the hip has a fan of muscles, so if you carefully lean backwards slightly or roll forward slightly, you can change the emphasis and change the muscle focus. Once you've softened the superficial gluteal tissues with the large foam roller, it's time to get into some more specific releases with a smaller roller. So you can use the little foot roller like I'm using here, but I've also had people use racket balls, the cross balls, tennis balls, any kind of thing you have laying around that'll work. I've even had clients use the small pool noodles, and I've also used the Franklin mini roll for this. The same thing applies to this as applies to the work with the big foam roller. Slow, take your time, be very targeted in what you're doing so that you're addressing the tissues that really need it. You can lean slightly backward or slightly forward to target the muscles that you really need. And I really can't emphasize enough here, this can be really intense work. So take your time, sink into the tissue, don't rush through it. Breathe, relax, and just let your tissues melt. Foot circles are a really easy way to mobilize your foot bones, re-engage your lower leg muscles and the intrinsic muscles in your foot. And they're pretty simple. Keep one leg straight and hold the other one up while you simply circle your foot around. I should say maybe this isn't so simple. You want to go slow and be very thorough with your motions. I like to travel both directions, clockwise and counterclockwise. Notice the speed at which I'm doing this is not blazing fast. It's slow and controlled, and I'm really focused and dialing into the movements and the various little hitches and subtle shifts in motion that happen in my foot. After doing some foot circling for mobilization of the entire foot, it's useful to do some point and flex work to increase the motions of plantar flexion and dorsiflexion. Dorsiflexion, or the movement we do when we lift our foot up off the gas pedal, is a motion that is often restricted by the strong, powerful calf muscles on the back of the leg. So this is especially important to mobilize. Another option people like for doing foot circling is to also draw the alphabet with your feet. So here are a couple calf stretches. Most people know the standard runner stretch or calf stretch where you dorsiflex your foot and lean your heel into the ground, like I'm modeling here. And that is great for the gastrocnemius, which is the outer calf muscle. It has two heads and really easily identifiable on the back of the leg. However, the soleus, which is the deeper muscle in this area that also attaches to the Achilles tendon, is a little bit more of a postural muscle, also really needs release, but it tends to not get as much when you do the straight leg gastroc stretch. One thing about gastrocnemius is it goes up onto the knee. So if we straighten the knee, we stretch gastroc. If we bend the knee, we stretch soleus. So I like to do calf stretches both with a straight knee and with a bent knee to make sure I'm targeting both of these muscles. As with any stretch, I always recommend you take it slow. This is not a power thing. Sink into it, be present with your tissue, and wait for it to release and to sink deeper in the stretch before you push deeper or move on. This little foot roller can be great for working out issues in your feet, but if you don't have a roller like this, a ball can work just as well. Notice that I'm not putting my entire weight on the roller. positioning it properly so that I'm getting the area in my foot that I need. And you just slowly sink into and explore and find tissues that are restricted, areas of motion that are just not as pliable, and sink into those spots. Be present with that tissue, listen for it to release, for it to soften, for the mobilizations to happen, and then you can shift and move on to the next spot. I typically start near the back of the plantar foot, near the heel, and then work my way forward, but it really doesn't matter. Again, as with all these techniques, slow, steady pressure, no jabbing, quick movements. We're finding tension, we're sinking into it, and we're letting it go. Another option is to work on your own feet. So pop your foot up in this position, and then you've got pretty much full access to use both hands to work with it. Probably the best advice I could give you is to study the movements and the shape of the foot, because the shape determines the movements. So let's break it down into its basic anatomical motions. So first we've got upward and downward movement. We call this dorsiflexion and plantar flexion. But a lot of what we're dealing with here is not the big movement of the ankle. What we're dealing with is the movements within the foot itself. So between the calcaneus or heel bone and the forefoot, which are all these long bones in the front part of the foot. So we've got up and down movement in there. From the top, you can see we have side-to-side movement. And then we've also got rotational movement, sometimes referred to as inversion, eversion, or pronation, supination. And notice how all those little bones have to slide around to make that happen. That's what we want to get. We want to get some sliding and some movement into all those bones. So here are the basic ways we do it. You can put one hand here, and just simply twist the foot within itself. You shouldn't have to hold too hard down here at the heel bone, and just start to move and twist these bones around. You can play with a little side-to-side motion, a little bit of up and down. And I like to do some rotational movements where you're just simply moving between all those different ranges all at once. And then I like to come in here and focus a little bit more on the front half of the foot. Or you can come in and focus more on the back half of the foot. There's not as much motion here, so it's a little bit trickier, but it is doable. And coming back in to finish it out with some movement of sliding the metatarsals, which are these long bones right through here, sliding those metatarsals around. And we can do kind of a bicycle pedaling motion where you're moving like this. And in addition, you can also use your thumbs, your knuckles if you found some interesting stuff while rolling out on the ball or the roller. If you found some stuff that just needs a little bit more pinpointed pressure, like right there for me now, that's a good spot. And you can kind of work those out. Not trying to be overly aggressive, just sink in until you feel some resistance, probably some discomfort, some feel so good kind of pain. And just sink in enough to challenge it, and then it will soften and release and ease. And then I always like to do some larger mobilization across the whole foot to see how everything's moving, and that is definitely better. So there we go, working with the feet. We hope that you found this self-care video helpful. If you enjoyed it, please like and subscribe and all that good stuff. And also check out our website at integrationnationbodywork.com. Thanks for watching.